Hello everyone. Today we are going to study about the pituitary and the hypothalamus. Basically everything from the basic we are going to start. So let's start. Disorders of pituitary and hypothalamus. Pituitary hormones and their principal action. Okay. Now as mentioned in this table, okay, we will study it one by one. Now, now these are the hormones of the pituitary. Now these are the hormones which are belongs to the pituitary, and these are the action of this pituitary hormone. Okay, right. Now anterior pituitary hormone. Now thyroid stimulating hormone, that is TSH. Growth hormone, that is GH. Follicle stimulating hormone, that is FSH, and luteinizing hormone, that is LH. Now we will see the action of its one by one. Now see, what does thyroid stimulating hormone do? It synthesizes and secretion of thyroxine, that is T4, and triiodothyronine. Basically, what is the mechanism of thyroid hormone? It synthesizes and the secretion of thyroxine, that is T4, and triiodothyronine, that is T3. Okay. Now growth hormone. What does the growth hormone do? Growth induction means it helps to help us for the growth. Okay. Yeah. Now follicle stimulating hormone and luteinizing hormone. What this do? Sex steroid production, follicle growth, germ cell maturation, and now in males, FSH and LH, it helps in production of spermatogenesis. FSH, it stimulates Sertoli cells to secrete androgen binding protein. Okay, transferrin, plasminogen, activator, and inhibin. Okay, yeah. Now, LH, it stimulates Leydig cells to produce the testosterone. Just remember the basic points of this: spermatogenesis, the Sertoli cells, which secretes androgen, transferrin, plasminogen. Okay, and LH, it stimulates Leydig cells. Just remember LH by Leydig cells. Okay, now females. Now, FSH and LH are necessary for development of corpus luteum during the luteal phase of menstrual cycle. Now, in menstrual cycle, FSH and LH both are necessary. Okay, why they are necessary? For the development of the corpus luteum. Okay, we all have studied the menstrual cycle. Okay, we all know what is the corpus luteum. FSH promotes growth and development of ovarian follicles during the follicular phase of menstrual cycle. LH LH surge, it induces ovulation. Surge is the peak. Okay, yeah, it induces the ovulation. Yeah. Now the next we will study is the prolactin. Okay. What does prolactin do? Prolactin controls milk production by breast. Yeah. Now adrenocorticotropic hormone, that is ACTH. It controls cortisol releases from the adrenal cortex and skin pigmentations. Okay. Yeah. Now we all studied about the anterior pituitary hormone. Let's go for the posterior pituitary hormones. What are the posterior pituitary hormones? See, they are arginine, vasopressin, okay, and the oxytocin. Now, what are the functions? Okay, what does these can do? Now, arginine, vasopressin promotes reabsorption of water by renal tubules. Okay, that is mechanism. It reabsorbs, resecretes back the water, okay, from by the renal tubules. And oxytocin, what does oxytocin do? It promotes uterine contraction and expression of milk from the breast. Yeah, see, when after your deliver a baby gets deliver, okay, there are the hormones which help us to secrete some milk. Okay, means it is the work of that hormone that now the milk is going to get secreted. So oxytocin helps in that. Okay, it's very prime and very important. Promotes uterine contraction and expression of milk from the breast. Now, is this okay? This, what are the anterior pituitary and posterior pituitary? Okay, yeah. Now we will go to the hypopituitarism. Okay, Now there can be a short note, a short essay on this in your exams. Okay, so just we have to mention what is that. Okay, yeah. And we will study in short. Now definition. Okay, always start your answer with the definition, the features, the investigations, what are the what are the pathogenesis, etiology for that. Okay, yeah. Now hypopituitarism is defined as combined deficiency. Combined is one or two. Okay, that is partial. Partial is little, or that is complete. Complete means the whole of any of the anterior pituitary hormone. Yeah. See, we'll repeat it again. Hypopituitarism is defined as combined deficiency, that is partial or complete, of any of the anterior pituitary hormones. Not related to the posterior, it is something to the related to the anterior pituitary hormones. Yeah. Now see, panhypopituitarism is defined as deficiency of all anterior pituitary hormones. Two terms you need to remember, that is hypopituitarism and the next is the panhypopituitarism. Yeah, panhypopituitarism is all related to the deficiency in the anterior pituitary hormones. It may be due to selective or multiple deficiencies of pituitary hormones or hypothalamic disease releasing the hormones. Yeah. Now see, etiology is the same as which we studied in this portion. Okay, anterior pituitary hormone, that is thyroid stimulating hormone, growth hormone, follicle stimulating hormone, that is FSH and LH, that is luteinizing hormone, prolactin and adrenocorticotropic hormones. Okay, yeah, this is quite simple, just you need to remember the gist of that. Okay, now we are going to study various causes of hypopituitarism. Okay, see, now mnemonic will help you a lot. A helpful mnemonic is a phrase 9. I'll just zoom it, you can just look out it. Yeah, okay. Yeah, see. 9 eyes. Okay, you should just remember 9 eye. Invasive, infarction, infiltrative, injury, immunologic, iatrogenic, infectious, idiopathic, and isolated. Okay, remember the 9 eyes: invasive, infarction, infiltrative, injury, immunological, heterogenic, infectious, idiopathic, isolated. Okay, now isolated hormone deficiencies, invasive tumors, pituitary adenomas, hypothalamic tumors, injury, surgery, irradiations, stalk sections, infarction, Sheehan's syndrome, the postpartum pituitary necrosis, diabetic antepartum necrosis, carotid aneurysm, inflammatory diseases, granulomatous disease, autoimmune hypophysis, infiltrative disease, that is hemochromatosis, amyloidosis, injury, head trauma, immunologic, lymphocytic hypocytis, infectious tuberculosis, syphilis, fungal infection, idiopathic, development defect, that is Kalman syndrome. Okay, now about all this syndrome we will be learning in our further videos. Okay, yeah. Now laboratory investigations. Now demonstration of low levels of tropic pituitary hormones. Okay, now what comes under this is low free thyroxine, that is T4, or with low or inappropriately normal TSH levels suggest secondary hypothyroidism. Okay, yeah. Now low early morning cortisols with the low or inappropriately normal ACTH, low testosterone level without elevations of gonadotropins that suggest hypogonadotropic hypogonadism. Okay, low IGF-1, that is insulin like growth hormone 1. Okay, level indicates good growth hormone deficiency. Now, provocation test. What is the provocation test? That is the growth factor reserves. Growth factor responds to insulin induced hypoglycemia. That is IDOPA, arginine, growth hormone releasing hormone, or growth hormone releasing peptides. Insulin induced hypoglycemia, also known as insulin tolerance test, is a gold standard test. Yeah, okay. Now, TRH reserves. Prolactin level fails to rise after TRH. Pituitary ACTH reserves, that is corticotropin releasing hormone, administration induced ACTH release, and administration of synthetic ACTH. Okay, causes adrenal cortisol release. It is an indirect indicator of pituitary ACTH reserve, that is ACTH reserve and TSH reserve. Now, surgical biopsy of tumors. So these are the laboratory investigations which will help us in finding the hypopituitarism. Okay. Now we will further we will learn about different types of syndromes which are mainly related with the hypopituitarism. Hope you like this video. Thank you.